Hello, hello. Dr. Brett Spradlin here at Divine Design Natural Health. Is anybody wanting to learn something? Great. Fall 2023 quarter 3 schedule is out. Today, October 9th, is Fast Aid, a little play on First Aid, how to avoid the ER, how to avoid the emergency room. November 6th, Family Feud Holiday Health Edition. What we're going to do with that is we're going to have a little Family Feud hoedown with some interesting questions, and it'll be a funny little thing at the very beginning, and then we'll teach people how to avoid family feuds over the holidays. Because year after year after year, it's like, here comes Thanksgiving, here comes Christmas, here comes New Year's, and people alienate themselves from their families because they're talking about eating healthy food and, you know, grandma, grandpa, uncles, aunts, get off those drugs. And then the uncles and aunts think you're crazy because they've never heard anything like this. So I thought, why don't we plan something so that we can help people avoid family feuds? That's November 6th. Bring all the family members that are going to hate you over the holidays. And then December 4th is movie night. As you know, we don't normally announce the movie nights, what they are, so we're going to keep you in suspense. So those are the 3 that we're doing for this quarter. With the holidays, things like that, we cut it back. We don't do 2 a week. We don't do every 2 weeks. We just do one a month. You guys ready to get into this? Do you have your thinking caps on? We're going to roll through a lot of stuff. Get your cameras ready. You might want to take some pictures of some of this. It's a lot of info. I'm going to try to get you all out of here by midnight. I'm not sure I can do it, but I use the same joke every well works. And I always like to see who falls for it. It's always a different crowd. All right, you guys ready? Let's do this. Let's get right into it. This is an abridged summary of these other previous Divine Design Natural Health events. DDNH 170, that's the Survivor FEMA Summer Camp Edition. 171, which is the Eugenics Agendas. And 127, which is Plant Power for the Next Plague. I've added a lot of new stuff in, but some of it is, a majority of it is going to be found in some of these other classes. I would highly recommend checking them out, and it tells you what's in each one of them. And moving on. Tonight, we're going to discuss why should you know this? Why and how should I change my lifestyle? ER stats for the U.S. and why you should not entertain fear. This is going to blow your mind. This is going to blow your mind. It's nuts. How to replace your entire medicine cabinet with products that won't kill you. How to save your time and money and maybe even your life by being your own emergency room, because how many of you have heard of people walking into a hospital, routine procedure, or going into the ER for something, and then they just never walk out? Now, I'm not throwing anybody under the bus. I'm throwing everybody under the bus opportunistically. American healthcare is in shambles. We'll get to that. Number 6, reasons to keep your own supply of natural remedies like supplements, herbals, liquids, oils, things like that. Number 7, how nutrition will keep you alive during the apocalypse. I'll just go ahead and say, if everything starts shutting down, it's going to be horribly easy for you to just go to the grocery store and get greens because everybody else is going to be buying the Pop-Tarts. How Divine Design is uniquely positioned to help you through the apocalypse, and the fastest acting supplements in the Divine Design arsenal, and the protocols that we never suggest. By the way, this class was first going to be an emergency, medical first responder type of a thing where we went into snake bites and bullet wounds and car accidents and how do you fix this and how do you fix that in case of things just totally falling apart. But I started realizing real quick, that's not why people go to emergency rooms. I'll explain that in a little while, but we are going to probably do in the near future a part 2 of this where we get into the deep, heavy-duty, nitty-gritty stuff, show people, if they want, how to bandage, how to splint, how to do Kendrick traction devices on broken femurs, stuff like that. I don't know, it could go as deep as we want it to go, but moral of the story, what I'm trying to say is I'm going to show you the top 10 to 20 reasons people go to ERs. It's going to blow your mind. And so in the near future, we might do a part 2 where we get into the nitty or grittier stuff. But along those lines, we're going to put together a list of all of the medical supplies, all of the things that the bandages, certain dressings, traction units, things like that you might need to splints, things that you need to have on hand maybe. And if you want that list, if you want access to that list in the future, let Nadia know up front, because we're not just going to give it out to anybody, but it's medical supplies that you should probably have on hand for the zombie apocalypse. And we're going to get that all prepared, and we'll probably put that out before we actually do that second class. So let Nadia know if you want to know what is the stuff that I'm going to need to survive the tranny zombie apocalypse. Okay? And second announcement, too, before we get totally crazy, is, you can come on in, is that tonight through Thursday the 12th, we're going to do 10% off on every standard process only and MediHerb supplement that I mentioned in tonight's class, FYI. So if there's some stuff in tonight's presentation that you're on and you want to stock up on it for the holidays and stuff like that, 10% off on all the standard process and MediHerb supplements mentioned by name in the event until the end of day on Thursday, October 12th. So anybody who's watching this now, great. If you watch it in the future, great. But that thing's only going until, the deal's only going until October 12th. And this includes, just keep your eyes and ears open, because this whole thing includes over 60 standard process supplements and over 40 MediHerb supplements. And those are the two, those are not the only lines that we use to great effect, but they are the two biggest and best lines that we use to great effect. Moving on, our catalyzing statement in the sacred service of saving lives ahead of time, and I mean this, saving lives ahead of time, we are fearlessly freeing billions of beings through all natural biblical health. We have not quite hit the billion mark yet, but we're getting close. Close. Next, caveats. American healthcare is a raging gasoline dumpster fire off a tall bridge. How many of you would argue that? Nobody would argue that. It's crazy. How many would agree with it? It's a catastrophe. It's an absolute catastrophe. The nurses say it. The doctors say it. The orderlies say it. The managers say it. Everybody says it. And certainly in the last 3 years, has it gotten better or worse? Much worse. Emergency medicine, however, I will say, is the most respectable branch, even though we got a lot of our techniques out of Nazi post-World War II techniques, like organ transplants and things like that. Where'd they learn how to do organ transplants? Not on willing participants. Where'd they learn to saw arms off and put them back on? World War II, concentration camps, right? So your heroic medicine that you're all loving out there came from satanic Nazi medicine in many cases. Just FYI. Don't believe me? Look at Operation Paperclip. Look at what happened to the Nazis when we brought him over to the United States. And look at all the pharmaceutical companies that they started. That's why they all have German names. Pfizer, Moderna, Merck. The list goes on and on. But it is a respectable branch in the fact that if somebody's leg gets knocked off, you can sew it back on. Or somebody gets in a car accident or a shark bite or a bullet wound or something. There is stuff that we've figured out that can help people out. But we will show you how not every emergency is an actual emergency. I will show you. Caveat, don't do silly things. Do what your levels of experience and faith allow. Every vessel travels at a different speed. People always ask me, what would you do if this or that? What would you do? I'm like, I'd die right here on the floor. I know where I'm going. I'm probably not going to subject myself to something that I don't want. Unless I'm bleeding out, unconscious, somebody hauls me to an emergency room and then they do all kinds of stuff that I don't have any control over. I'm going to do everything in my power to not do stupid stuff, like climb up on top of things that are moving. I'm done with those days, right? So just don't do silly stuff. But if you do silly stuff, at least have your level of experience, what you've experienced in this world and what you will and will not to do, and your level of faith better come to a convergence at some point. 3 years ago, your doctors and politicians wanted to put you in jail for not taking the lethal injection. I hope everybody knows what I mean by this. Today, everyone has forgotten. We're 4 years into this. Everybody forgot, and they're going right back to get procedures and medications from the same doctors. Yes or yes? All your friends, all your family, they forgot. Doctors wanted them dead. Experimental lethal injection. Not going to take it? We don't want to treat you. Same people. If you love drugs, surgeries, vaccines, we hope you have your affairs in order. The world has officially changed. What do I mean by that? The drugs are not the same. The vaccines never were vaccines. By the way, immunizations, inoculations, and vaccines, the medical world uses those terms interchangeably. They're not interchangeable. They're three different things. People don't know this. But I hope you have your affairs in order. If you love your premiums and deductibles and copays and prescriptions, I hope you have your affairs in order. Because the stuff they're putting in people's veins today, 3 to 5 years. Hope you have your stuff in order. If you eat crap, you drink crap, you take crap drugs, don't expect miracles, okay? You are responsible for taking care of yourself. I could preach on that for all day long, but I won't. Another caveat. If you're on psych meds or any other med, but particularly psych meds, we'll talk about why later, you may seriously want to consider what happens if you no longer have access to those poisons. Because after years of poisoning yourself toxically, you can cause a nuclear meltdown if you go cold turkey. Instantly, just big time, big time, big time, big time. So the average person's gut reaction is to run to the ER at the first sign of distress. Would you disagree with that? Most people, my kid's got an earache. Should I take him to the ER? Everything we're going to talk about tonight, by the way, everything we're going to talk about tonight is emergency rooms only. Hospital-based emergency rooms. I am not talking about the 6 urgent care centers or express medical that are within like a half-mile radius of this office and growing every day, by the way. I'm not talking about those. I'm talking about ERs. Why? Because of the stats we found. It'll shock you. What if there's a better way, though? Everybody runs. Kids got a fever. Should I take them to the ER? You've heard it. You've heard it. We've all heard it. Back pain, lacerations, snake bites, bruises, broken bones, pain control, pregnancy, strains and sprains, diarrhea, toothaches, earaches, chest pain, shortness of breath, trauma, bleeding, right? You would think that this would be a short list of real legitimate reasons, some of them way more legitimate than others, not legitimate, right? You'd think some of these are like, okay, if I get bit by a copperhead, I might maybe think about going to get the antidote. But knowing what I know now, I probably wouldn't. Why? Because in the future, we'll talk about some of these things. What if there's a better way, though? Moving on. Why should you know this? Well, you should have access to your own apothecary of supplements, herbs, oils, and emergency skills. What does that mean? You have access to some of the top companies in the world that make stuff for healthcare professionals only, that do not sell their things in stores or online. That's what I mean by that. You can build your own access. You can build your own apothecary of stuff that would take you decades, generations to grow and understand how to grow and extract and do and capsulize on your own. You have things with the nutritional technology that's available today, just by having like a Vitamix, right? Puts you way ahead of the curve for like the last 500 years. The nutritional technology that's out there today, it's crazy. So if you count the supplements and the capsules and the tablets that were created by people understanding the onslaught of disease that was going to come 120 something years ago just by processed food, they foresaw it. You have access to all that, right? There it is, right there. Your doctors, your schools, your media, and I'm sorry to say even your churches are not teaching any type of health or economic preparedness. Economic preparedness, we like to help people. That's why we did the root of all evil classes. We like to show people the future is Bitcoin, whether you like it or not. We like to show people you can transact, you can be your own bank, you can send something anywhere around the world with no one standing between you and the other person for the first time in history. It's like the printing press, only better. And this does money. This doesn't just do books. Like you can send this around the world. So we help people with economic preparedness, help them to understand why and how to do it. And then the health thing, that's what we've always done, right? But your 401ks and your IRAs and all this stuff are going bye-bye. They're going bye-bye. Oh, and by the way, your dollar is going bye-bye. So we're trying to help people get ahead of this. Your survival often depends on you and you alone. Too many people have given up their sovereignty to somebody they don't even know just because some stranger on the TV told them to, right? You do not want to take shelter in the medical house of cards with dependence upon CPAPs for your spouse, inhalers for your kids, and insulin for yourself. You're a target. You don't want to do that, right? When you can't live without plugging in your CPAP and the grid goes down, I'd really consider changing your stance on a few things. We could be affected by tornadoes or other disasters. Who knows? I mean, we're letting, how many million people across the border to come here? Like, nobody cares if they're vaccinated, right? Look at what happened in the last few years. Something could happen. Why should you know this? You got to take care of yourself. Build up your nutritional bank account ahead of time. When all hell breaks loose, I'll tell you, the first place it's going to be robbed, right here. Number one, 100%. Better, more than the banks, right there. And to avoid the government-sponsored FEMA camps, you must be self-reliant and prepared, okay? Oh, yeah, okay. Well, some people would say, well, I'll just take my drugs, my Costco vitamins, and the supplements I buy from Dr. Internet, right? Royal Lee, 100 years ago, said you can give a chemist a watch and he can analyze it for content. then hit it with a hammer and give it back to them. Although it's the same watch, it's now lost its function. A nutritional concentrate is an organized mechanism that has a function. If you break the function by separating the parts, the body can no longer use the mechanism. You see people doing this all day long because they'll take vitamin C, right? They'll take 1,000 milligram tablets of vitamin C from Costco and Rite Aid and Walmart, Walgreens, and this and that. That ascorbic acid that the FDA allows you to call vitamin C, because it's part of the vitamin C complex, is easily made in a laboratory from petrochemical pharmaceutical stuff, right? So the FDA still allows that ascorbic acid to be sold as vitamin C, but it's not a vitamin C. It's that nutritional concentrate, that vitamin C, is an organized mechanism that has a function. If you break the function by separating the parts, ascorbic acid, it no longer functions the right way, right? So it will cause bigger stress, more stress on your body. So if you're taking your Costco stuff and your drugs and your crap from Dr. Internet during the apocalypse, what's going to happen? You might as well just eat the Pop-Tarts. It's going to kill you, right? Because your body's going to be going through stress. It won't kill you right away. But what I'm saying is your body's going to be going through stress, and you're going to cause a bigger problem that your body now has to heal from. It has to heal from the problem, and then it has to heal from the solution. He also said, using high potency, and I inserted AKA synthetic megadosed nutraceuticals. So using high potency vitamins is like whipping a tired horse. He will be stimulated to run faster, but sooner or later he collapses because you never fed him, right? So people with hypothyroidism are people who had hyperthyroidism for a long time, and now the thyroid is just dying. It's just running, trying to keep up, hyper for years, and then it just starts petering out and goes hypo, because it's been running a marathon for 10 years, right? That's what he's talking about right there. So why and how should I change my lifestyle? Well, we can cancel your surgeries, we can slash your prescriptions, we can get your life back, you can get a job, you can get a second job, you can get your old job back, you can hop on the highway and drive a car for the first time in 10 years because you had anxiety and you didn't want to drive next to semis. The list goes on. Your program should quickly move from once per week to once every 4 to 6 weeks. That means I see you once a week at the very beginning, cut you back to 4 to 6 weeks when you get better. It's easy. You regain, and then you maintain your health in an ever increasingly toxic world. How many of you know all the crap they're spraying is increasing, right? Next. The detox methods we use can literally save your life many times over in a fraction of the time expected. Why? How is that possible? Because your medical doctors don't know anything about detox because they're toxifying you with all the drugs. So how could they possibly tell you to detox? It goes against exactly what their philosophy is. I've heard some people describe this as nutritional salvation, right? When you understand how to eat and how to take care of your body and how to avoid being poisoned, right? It's basically like nutritional salvation. Diet is the word die followed by a cross. Put that in there. Thought that was kind of interesting. Somebody needed to hear that. And in a shizzle hits the fizzle scenario, you do not want to be dependent on all the stuff we talked about before. Okay, next. That was just a quick little, here's some credentials. I've done a lot of outdoor activities, studied a lot of stuff for years, member of National Ski Patrol, so non-ambulatory care. Somebody's in a tree well, their legs point in the wrong direction, whatever. You got to haul them out, get them to an ambulance, but you got to keep them alive between point A and point B. BLS, CPR, all the regular crap, bunch of crap, moving on. Lived all over, dissected a bunch of people. So, hey, dissecting small animals comes naturally. I don't know why I put that in there. I just thought you'd get a kick out of it. Be careful who lays hands on you in these strange times. We talked about that back in New Age for old devils. Next. So here's our 7 tools, how it all works. And then I'm going to show you the most interesting statistics on ERs you'll ever see in your life. This is how it is. This is, if I could sum up what we do in one slide, there it is. We only use 7 things: light, water, heat, electricity, plants, animals, and my hands. What does the detox do? Well, we put more blood, get more blood going to your food, air, and water organs. That's your bowels, your lungs, and your kidneys. The sauna, you sweat out months or years of toxic accumulation. You fry all the bad guys, and you denature all the synthetic nonsense that's floating around in your blood, and your body can remove it. PEMF. People who have 5G and EMF toxicity, with broken bones, dental abscesses, overall well-being. You recharge the cellular membranes because you can only get sick if your body loses voltage, right? When the cellular membranes lose voltage, things that aren't supposed to get in, and things that aren't supposed to go out, get out. You restore the voltage to the cell, boom, it stays healthy. Cold laser, you're using light to stimulate the DNA to heal damaged tissue. So the point here, big point, everything we do stimulates and restores blood flow. All of these things. Blood flow, blood flow, blood flow, blood flow. Chiropractic, I didn't even put it on there. Blood flow. It's not about alignment. It's not about getting rid of pain. It's about blood flow. It's because the life of the flesh is in the... On the other side, drugs and lethal injections poison what? There you have it. You can think about it, argue with me, you can talk smack, you can do whatever you want to do. But right here, you cannot poke a hole in that. No one will. No one. That's it. If I were to sum up everything, the nutrition, the chiro, everything, all it does is restore blood flow. Right? There is no special Himalayan-grown mushroom from under a Sherpa cow pie that everybody needs that's just magical. There's no implant, no sticky stuff you put on your body. It doesn't matter. You cannot stimulate your DNA and you cannot restore organs and regrow hearts and lungs and kidneys without consuming hearts and lungs and kidneys. Medicine doesn't teach you this. Next. So, yeah. Commercial break. See how we put the commercials in there just to lead you on? just to tease you a little bit? Okay. Isn't that horrible? Come on up. Everybody give Sam a round of applause. There she is. Go for it.
All right. This patient said, a surgeon told me that my gallbladder was not contracting at all and that my appendix would need to come out, even though the imaging used to diagnose this was 2 months old. The surgeon actually told me that my appendix had no use because humans don't eat the same things anymore. After coming to Dr. Spradlin, my gallbladder is back to functioning and I no longer vomit every day. I'm so thankful to have avoided surgery and to still have my gallbladder and my appendix. So that's awesome.
Now, some people would hate that because they want to have their gallbladder and their appendix taken out so they can get off work or they can have attention from somebody or whatever. But you don't make a lot of friends doing this, I'll tell you that. But you do make friends doing this. What do? God's work. Are you a priest? Not really. Taking down the surveillance cameras. I don't know if some people didn't seem not to laugh like they should have. Okay. Understand, it's never just a gut problem. It is never just a skin problem, a liver problem, a brain problem, a sleep problem. Ladies, it's never just a thyroid problem. I've heard that for years. It's never just an immune problem. It's never just a hormonal, metabolic, nutritional problem. It's also a toxicity problem. It has to be. By definition. Cancer, by definition, is a toxicity problem. It is not a genetic problem. It is a toxicity problem. Your body is trying to pee, poo, breathe, sweat, and bleed everything out of its body that it can. What do you think a tumor is? It's just a walled off little chunk of stuff that your body doesn't want to get anywhere else. It wants to wall it off and keep it in one spot so that it doesn't go elsewhere, right? That's what cancer is. Simply, very simply. Next. Me, anytime the government says its new program is going to keep me safe. New World Order. That is a new meme, but that's going to be a classic one of these days. That's going to be a classic. You're going to see that everywhere at some point. It's classic. New World Order. Oh, yeah, go back one more time. We got to appreciate that. New World Order. Most of society taking a selfie. Isn't that great? Hilarious. And remember, if all the headlines are identical, it's not news, it's advertising. Yeah, really. People still believe the news. I don't know why. How many shots until you catch on that they're trying to kill you? Kermit the Frog, the great prophet. All right, 2021 statistics on ER visits. I'm going to show you some stuff that will blow your mind. Get your thinking caps on. We're going to rage through this. There are 8 charts coming up. This is number 1. There are 8 charts. Now, remember, this is 2021. This is the best. Now, we'll do a 2021, this is a 40-page document I ripped all this stuff out of from the CDC, from our good friends, solid, beautiful, awesome, loving people at the CDC. 40-page document. I pulled eight little charts out, tables. And then I'm going to show you an overview of 2022 so we get round about roughly the same stuff. Just show you. What is this? 10 principal reasons for emergency department visits by patient age and sex. So basically, it breaks it down into male and female and ages 15 and below and 15 to 65 and 65 and up. But this is the massive summary of this massive 40-page document. 10 principal reasons. What do you see? So we've got, first of all, the number of visits in thousands, and then there's the standard error here. Number of visits in thousands. So this would be 139 with 1,000 at the end of it, 139 million. Everybody follow that? Now, keep in mind, this is just ERs. This is not your urgent care. This is not your walk-in clinic. This is not your express dock-in-a-box walk-in place, okay? 139 million ER visits. First thing that comes to my mind is how many people are there in the United States?
70 million.
In the United States?
Yeah.
330 million. 330 million. So what does that tell you when 140 million people walked into the emergency room?
About half or a little less than that.
That tells you got some people. How many people in here have been in the emergency room in the last year? Do you know anybody that's been to the emergency room in the last year? I don't. 2 people. 2 people out of 20?
Well,
So what I'm saying is you've got some frequent flyers. You've got people that are going to the emergency room when they shouldn't be going to the emergency room. How do I know? I just took one look at this thing. Stomach and abdominal pain, cramps and spasms, 12 million visits. Chest pain and related symptoms. What do you know about chest pain from watching the We Heart You 2 class? What do you know about chest pain? You can fix it in about 30 seconds. Chest pain is a nutritional thing, by the way. Shortness of breath. I won't get into it right now. Shortness of breath. 2021, remember everybody thought they had, the COVIDs, right? Cough, fever, headache, pain, back symptoms, vomiting, other symptoms or problems relating to psychological and mental disorders, right? Those are the top 10 reasons people walked into the ER in 2021. What is conspicuously missing?
True emergencies.
Traumas. True emergencies. Nurse of 52 years. She notices it right away, right? Now, probably back in the 50s, 60s, 70s, people probably only went to the ERs when, real stuff was going down, right? Somebody fell off a ladder in the backyard. Somebody shot themselves accidentally, blew their foot or their hand off or something, right? Look where we are in 2021. Stomach pain, cough, fever, headache. I mean, some of the stuff, back symptoms, how's this an emergency? I'll show you though. But this is hospital ERs, not urgent cares, not walk-in clinics. It's hospital ERs. Hospital ERs. Okay? Now, I'll just kind of point this out real quick. I know nobody can see this, but it's the smallest it's the biggest I can make it. Primary diagnosis at emergency departments. Here it is again, 139 million visits out of 330 million people, of which hardly anybody knows anybody who actually goes to the emergency room, right? So these people are frequent flyers. Neoplasms, what's that? Cancer, 316,000, right? Then you've got diseases of the blood and blood-forming organs, certain disorders. Little tiny numbers here. Diseases of the nervous system. So these are the diagnoses, okay? They walk in, they've got epileptic seizures, they've got twitching, they've got this, they've got that. They get diagnosed as a nervous system disorder, okay? The biggest ones, look at this, respiratory system. I wonder what was happening in 2021 where everybody got diagnosed with the same thing. Then you've got symptom, signs, abnormal clinical and laboratory findings, 36 million. Injury, poisoning, and certain other consequences of external causes, 23 million, of which you've got all the injuries in here, like head, neck, thorax. So out of 140 million people, all of your injuries constitute only 24 million visits. Do you get what I'm saying? 24 million, that's less than 1% of all of, it's not injuries. Most people are going to the ER for. When you talk to people about, well, what happens if there's an accident? What happens if I have this? Or what happens if I get in a car accident? Well, that's why you have car insurance. Like, why are you betting on yourself that you're going to have an accident? I don't confess that into my life, and you probably shouldn't either. But all the injuries are right here, okay? Right here. Tiny numbers. Tiny little numbers. So where do all these other things come from? Oh, we'll show you. But right here, I wanted to show you the top 10 reasons. All the visits, right here, 139 million. You're going to see that over and over again. And the injuries are 23 million. Remember that. Next, table 12. goes into presence of chronic conditions at emergency department visits. This means these chronic conditions have been around before they walked in. Look at this. Interesting. And remember, this is straight from the CDC. Anybody can go and download this thing. I'll show you the source at the end of it. You can go download this thing. Good reading. It's 40 pages of stuff. While you're sitting on the toilet, it's about the only time I'd read it. 140 million. Alcohol misuse, Alzheimer's disease. I mean, these are the chronic conditions that are walking into the thing, right? Asthma, cancer, cerebrovascular disease, chronic kidney disease, obstructive pulmonary disease, congestive heart failure, diabetes, end-stage kidney disease, pulmonary embolism, HIV, AIDS. It's a whole nother story. Don't get me going there. But what are the biggest numbers? Watch this. Watch this. Biggest numbers, chronic conditions, people walking into ERs, US 2021, hypertension, high blood pressure, hyperlipidemia, fancy word for high cholesterol. What do you think they walked out of the ER with when they walked in with those conditions? I'll show you why. The rest of these, none of the above. 65 million people didn't have any of these presence of chronic conditions, but well over half had chronic conditions before they reported to the ER, right? I'll show you why later on. Next. Emergency department, yes, emergency department visits relating to injury, poisoning, right? Adverse effects. So look at this. All injuries, these are all the injuries, 40 million. I couldn't figure out why this was a different number than on the other sheet, which was 24 million, 40 million, same thing, right? All of your motor vehicle accidents right here. All transportation, 5 million. See that? 5 million people got in a car accident and went to the ER. Out of 330 million, and a lot of people driving every day. What am I getting at? Your chances of getting in a really bad accident are very, very, very small. A lot of people live in way too much fear, is my point. Look at this. Firearms. Doesn't even register. That means it was below 30,000. On this thing, that means it was below 30,000. Yep, the firearms are killing everybody. Yeah, that's all I wanted you to see there. Firearms. Oh, yeah. And all of this is all transportation. That's your motor vehicle accidents. That's your pedal cyclists. That's your pedestrians and all other land transport. 5 million ER visits. That's not a lot. I mean, look at that. That's 12%, right? You've got the percent distribution over here with the standard error in the parentheses. Okay, what am I gathering out of that? You are almost guaranteed that you're not going to have any of these problems as long as you don't do stupid stuff. Don't be going skateboarding, with carrying a pair of scissors, right? Next. Table 17 is selected diagnostic and screening services. So that means when you walk into the ER, they monitor all of this stuff. This is crazy. So you walk into the ER, here's how many people got diagnostic tests, meaning like blood labs or imaging, CAT scans, MRIs, x-rays, things like that. Watch this. There's your 140 million number again, right? All your blood tests, look at that. Half of those people got a complete blood count, which is part of a comprehensive metabolic panel, but that's another huge number right there. So half of those people are going to get blood tests. Imaging, you got a third of those people getting x-rays. You got another third of them getting CAT scans. And you've got any imaging whatsoever, you got 75 million. Half the people who walked into the ER, you're getting imaging, you're getting a blood lab. Period. End of story, right? And then other exams and tests down here, tons of tests. Urine test, toxicology screen, yada, yada, yada. How many tests can we order? Who knows? What kind of insurance do you have, right? So you're almost guaranteed. My point here, you're almost guaranteed a diagnostic test or a blood test or imaging, right? Table 18, we're almost done with all this nonsense. Selected procedures, different than diagnostic imaging or labs. This is a selected procedure, right? So out of 140 million, one or more of these procedures happen in 46% of people. They got a cast, they got a splint, they got a wrap, they got sutures, they got staples, they got some kind of exam, they got intubated, something. 46% of them got some kind of procedure performed, okay? Out of 140 million people. Oh, and, last one. Meds in the ER, table 19. Oh, no, there's one more after this, but table 19. Medication therapy and number of medications mentioned in emergency department visits. So, well, out of 140 million people, visits with mention of medication, 76%. And what does that mean? That there were 352,609,000 drug mentions at emergency department visits in 2021. Basically, I'll cut the rest of this out for you. The average drug visit rate was 3.5 drugs per visit. Each person walked in, 3.5 drugs. That's the average, right? If you just look at here and go that way. So 20, 40, 50, 60, 70% of people got about, got a bunch of drugs. Next. Last but not least, 20 most frequently mentioned drugs at emergency department visits. This is going to play desperately into something that we're going to talk about later. 20 most frequently mentioned drugs. Number 1, analgesic is a big word for painkiller. Number 2, minerals and electrolytes. What does that mean? Salt and sugar. That's what that means. Next is antiemetic or anti-vertigo agents. What does that mean? Anti-vomiting drugs. Why is your body trying to vomit? To get poisons out. So we give you poisons so that you don't puke the poisons out. Miscellaneous respiratory agents. Anxiolytics, that's a psychiatric med to stop your anxiety, or a sedative or hypnotics. I mean, look at this. Antibiotics, bronchodilators, anticonvulsants, adrenal corticosteroids, radio contrast agents. They've got radio isotopes that they pump into your veins so that they can do a CAT scan or a PET scan or something like that. But basically, look at all these quadruple or 5-digit numbers going this way, and you've got 23, 33, 43, 53. You got 60% of people getting these drugs. It's crazy. But number 1 is analgesics, painkillers. I want you to see that, okay? And that's 25%. Go back. 25% of people are getting a painkiller when they walk into an ER. And then the next 12% is just getting horribly overpriced minerals and salt and sugar. That's what that is. Next. So, what does all that say? Well, go to the, No, we go to the, sorry, that's on the wrong, go to the 2022 stats on ER visits link. It's a link. That's in the wrong order, I think. Oh, no, that was in the right order. You screwed that up. Why are you screwing that up? So while he's doing that, so what's curiously missing? Injuries, we talked about. And then people always ask, well, what about insurance? Should I pay out of pocket or what? If I don't have insurance coverage, yada, yada, yada. Yeah, if you pay out of pocket, what happens to your bill? Usually
Goes way down.
way down. 40 to 60%, maybe sometimes 80% way down if you don't have medical coverage. So I just tell people, cancel your insurance. I mean, it's up to you. Like I said, your experience and your levels of faith and this and that have to be. Everybody travels, every vessel goes at a different speed. That's what we said at the very beginning. I'm not telling you what to do. I'm just saying, here's an option. What if you canceled your insurance? You stopped being robbed out of your paycheck every 2 weeks for something that you're not going to use, drugs and surgery. And then you took that money and put it into your health care, and you got healthier, and you got more maintenance in your health care rather than just waiting for something to fall off, the wheels to fall off the car. And then you put that 10 grand or 15 grand or whatever back in your pocket from your annual insurance premiums, and you saved a bunch of money, and you got healthier. Just an idea. Let's go to this link. Just an idea. I know people here, patients who have saved $10,000, $15,000, $20,000 just by doing that.
Is this the link you're looking for here?
No, the definitive HC. Yeah, that was in the right order. Yeah. Here we are. So I thought, no, this can't even be right. After looking at all the CDC stuff and just digging through all that data, I thought, this can't even be right. Maybe I'm just looking at an anomaly because it was 2021. So I just pulled this up. And this is a data aggregator for 2022, most common ER diagnoses. And there it is right there. 2022, most common diagnoses. What's number 1? High blood pressure. Number 2, suspected exposure to COVIDs. Number 3, what is number 3? Long-term drug therapy. Reasons for reporting to an ER. Can you believe this? So scroll down a little bit. I'll come back to this top 20 thing. Just scroll down to this, what causes the most emergency room visits. Here we are. Essential primary hypertension was the most common reason for ER visits in 2022, 3% of total diagnoses. Hypertension is a common disease that increases the risk of heart attack, stroke, renal failure, and even death. Exposure to the COVIDs was the second most common reason for ER visits. I won't even say the word. Total trips to the emergency department in 2002 is 2%, right? So what we're saying right here is hypertension is a chronic disease. What does everybody who comes here as a patient knows? Is hypertension a disease? No. What is it caused by? Food and drugs, right? So let's go to the slide. And I took all those, big fancy words and I put them into this one little thing here. So the 2022 stats in plain English, here it is. This is going to blow your mind. So while he's doing that, oh, there we go. 2022 stats in plain English. So number 1 was high blood pressure. Number 2 was COVID's exposure. There's a reason why I call it that. They're giving people AIDS, by the way. Immune deficiency. That's why I call it that, just if you didn't know. People ask me every once in a while, are you pronouncing that wrong? No, I'm pronouncing it right. The people who are telling you COVID, they're pronouncing it wrong. Because the vaccine and acquired immune deficiency. That's what they're giving people. They get enough shots and their immune system goes down the toilet. I'll show you some articles later on where they actually call it COVIDs. Long-term drugs, number 3. It's crazy. Long-term drugs. Number 3 reason for going to the emergency room. See why when I looked at this data, it changed the direction of this class because I thought, well, shoot, we could be teaching you how to fix a bullet wound, but nobody's going to go to the emergency room for a bullet wound. I know how to keep people out of the ER way ahead of time. We're saving lives ahead of time, literally, right? This right here, cholesterol is not your enemy, my friend. It's your friend, my friend. Type 2 diabetes. Hold on. What causes high blood pressure? Food and drugs. What causes COVID's exposure? TV. What causes long-term drug problems? Food and drugs. What causes the cholesterol problem? The TV, but then food and drugs. What causes type 2 diabetes? Food and drugs. What causes breast cancer? So people actually report, I couldn't believe this. I actually called somebody and talked to him and said, hey, what does this mean? I don't believe this. They say, oh yeah, that means they found a lump in the breast. They went to the ER. So breast cancer mammogram, boom. What causes that? Food and drugs. This is actually literally number 7 on the 2022 stats, and I could not believe it. Presenting to the ER saying they're dependent on nicotine. Nicotine is not even habit forming. It's on the cigarette things. It says, and you're standing at the gas pump and they have the chew and the snuff and everything. It says, be careful, nicotine is an addictive chemical. It's not. It never was. Never was. What is addictive is the chemicals they put in it. They put the chemicals in it. Everybody wonders, why is there so many chemicals in cigarette smoke? They put that in the tobacco to get you hooked because the nicotine won't hook you. It's unbelievable. Unbelievable. There is no nicotine dependence. It's people are addicted to the chemicals. Chest pain. How does that start? We Heart You 2 class. The We Heart You 2 class. Chest pain, it's a muscle cramp. Could be MSG. But food and drugs, right? So the heart's a muscle. The muscle goes into cramps and spasms. You feel chest pain, angina pectoris. You go to the ER, they're going to give you nitroglycerin, right? Put it on your tongue. Why do they put it on your tongue? Because your taste buds are connected to your heart. Nutrition. See, they know how important it is, right? So you put supplements on somebody's tongue. You put food on somebody's tongue. Does your body instantly react? Put a habanero pepper. I'll prove it to you. Put peppermint on your tongue, right? Your whole body reacts. So people say, oh, nutrition can't fix that. Oh, yeah? Really? You're waiting for your atheist with a white coat on with snakes on his name tag to show up and give you nitro. Right? Because you don't think God's food could be more powerful than an atheist drug. Your faith is shattered, my friend, not mine. Not mine. GERD. People go to the ER with GERD. We fix that and, gastroesophageal reflux, it's heartburn. It's heartburn. It's stupid. It's heartburn. What causes it? I wonder. Food and drugs. You fix that in about 10 seconds. Heart disease, what causes that? What's the number one killer in the world? Heart disease. Why? Because of nutrition. Because your heart eats first. Remember? And you will never have what type of cancer?
Heart cancer.
Heart cancer. You will never hear of any human with what type of cancer? It's unbelievable. But you've got heart centers for excellence. They're all top 10 in the world, by the way, wherever you go. You've got heart centers in every city saying they're the best place in the world for heart disease, right? Shortness of breath. What does that mean? That means a standard operating procedure, SOP, of antibiotic and an steroid when you walk in. That's it. What causes shortness of breath? Food and drugs. Unless you got kicked in the chest by a horse, I suppose, there could be some of that. But shortness of breath, like allergies, asthma, right? What causes that? Food and drugs. They would tell you on TV it's pollen, that everybody's allergic to the air. And then this was exposure to COVIDs. This is actual COVIDs. This is 2022. Hypothyroidism, sound like an emergency to you? No. Are you blown away by this? Is this crazy or is this crazy? You're shaking your head like, oh yeah. This right here, number 15, somebody just shows up, they want a general adult medical exam because they say, I don't feel good. That's what that means. Cough, abdominal pain, anxiety, chest pain, other, different than this. That's unspecified. This is other, totally different unspecified other. And then headache. My friends, I present to you American healthcare. It's not hard to beat that. Not hard to beat that at all. Our competitors aren't competitors, if that's all we got to worry about. Professional observation. So why do people often go to the ER? Why do you have 330 million people in the United States, most of which don't touch an ER, never have, but you've got 140 million visits just at the ERs, not counting the urgent care centers. Why? So they don't have to wait for an appointment at their primary care. That's reason number one. And number two, their primary care doctor tells them to go to the ER. Isn't that nuts? Is that right or is that right? That's nuts. That's crazy. Next. Oh, and I'll tell you this too. Just stop right there for a minute. Years ago, I've had every type of medical professional in here as a patient except a medical doctor. Every type. Dentists, pharmacists, you name it. And years ago, probably 6 years ago, I had a physician's assistant and we were talking and I said, hey, explain to me those gimmicky, stupid billboards on the highway where it says, 15-minute wait time at the ER. And he said, oh yeah, that's just a marketing gimmick. And I said, well, I kind of had a feeling, but why? And he's like, well, the wait time isn't really like what you wait for to get care. The wait time is how long it takes to get your demographics, your insurance card, and your intake paperwork. So it's just strictly a marketing gimmick, FYI. So all of that is to say this: the most important aspect of life, and particularly in a without rule of law or a shizzle hits the fizzle type of scenario, know who put you here, know why he put you here, and then know where you're going when you are no longer here. This is the most important thing. You want to take a picture of that slide right there? Like that's the purpose. If you know this, you are not going to run to the ER every 5 minutes because your kid has a fever. Right or right? Moving on. Where's the link? Drugs.com link right there. Everybody, let's give Jonathan a round of applause. He's doing a great job back there. Doing a great job. There it is. How many of you have ever heard of this? You're about to. Here's what it is. It's the zombie drug. It's a drug that created by a pharmaceutical company to resurrect a dead person after they've had a heroin overdose or an opiate overdose. Okay, so now all of the trucks and all the ambulances and all the fire trucks and all the schools, libraries, everybody is having to carry Narcan, which is naloxone, nasal spray. I didn't even know it was a nasal spray until just recently, until just this. It's ridiculous. It's an over-the-counter medicine used to treat an opioid overdose emergency. Narcan works by rapidly reversing the opioid's effects, should be given as soon as possible when there was an overdose expected. Narcan nasal spray became FDA approved 6 months ago. as an over-the-counter OTC medicine without the need for a prescription. But wait a minute, you have to have opioids. You had to have a prescription to get the opioids that you overdosed on, right? So you don't even have to have a prescription for this. You can just go down to Walgreens and buy this. Like, kids, you can buy this out of a vending machine. They're keeping it in grade schools. It's crazy. Until the OTC nasal spray became available, the spray with the prescription label will still be available from a pharmacist without a prescription from your doctor under state and naloxone access laws or alternate arrangements. Nasal spray can be used for adults or children. Narcan works to block the opioid effect as it is an opioid antagonist as it competes for the opiate receptors in the brain and other areas of the body to help reverse the dangerous effects of opioid so that the patient's breathing improves and they become more awake and their blood pressure normalizes. So somebody shows up on a scene, you jam them with Narcan. If they're dead, they're coded, no pulse, no heart rate. You jam them with Narcan. If they come back to life, what do you know they had in their system? Opioids. This is everywhere. I mean, there's billboards in certain parts of the country with this all over it. So why am I telling you this? Let's look at the true emergencies.
To opiate users.
Huh?
It's a comfort for opiate users.
It's a comfort to opioid users because now you can buy it without a prescription at the Walgreens, Rite Aid, CVS, and you can just keep it in your house, shoot up. You know, hopefully somebody's there to administer the nasal spray to you. I'll tell you, somebody had a really long day with this. I'll tell you here in a little while. But true emergencies, like firefighters give a ninja cocktail to unconscious victims to wake them up. Now, this isn't everywhere. This is not in Bradley County. Ninja cocktail, this thing's probably big city. This is probably, San Francisco or some other crap hole that has been infested with demons for decades. But they pump somebody, they show up, somebody's unconscious, they pump them with Narcan in case it's an opioid overdose. They pump them with sugar in case it's a diabetic. They pump them with flumazenil, which is the antidote to a benzo overdose. All your benzos, all your psych meds like Valium and Xanax and Versed and Ativan and all this stuff, all the psychotic antidepressant things that if you take it with alcohol just completely fries your brain, which is why so many people are fried nowadays. If you show up, they're unconscious, you jam them with vitamins and B12, they wake up, they're an alcoholic. So if you jam them with all four of these things, you jam them with Narcan, they wake up. They're dead, you jam them with Narcan, it's an opioid. They're dead, you jam them with sugar, probably a diabetic. They're dead, you jam them with flumazenil, they probably OD'd on benzos, probably with alcohol. And then if you show up and they're dead and you jam them with vitamins and B12, they're an alcoholic. So you just show up and you jam them with this stuff, the ninja cocktail, and somebody comes back to life. The only problem is you still don't know which one worked when they wake up. You don't know if they're a heroin addict, a diabetic, if they're addicted to benzos, or they're an alcoholic. You have no idea. But here's the personal note. Out of looking at this, in every instance, both the poison and the antidote are from the same or very closely related companies. You can't make this up. And who's making it all? Your government. That's your government. So in 2016, I went and rode around with some EMTs and some EMS guys. This is going to blow your mind. This is Bradley County. 6,640 calls for the quarter back. That was probably early 2016. And about 10 calls a month. Remember that number. 10 calls a month are actual emergencies. If you extrapolate that out, so for a quarter, 6,700 calls a quarter, that ends up being about 26,000 calls for the year. That may be 120 true emergencies out of the entire 12-month year. Easily less than 1% were legitimate emergencies back then. The rest are medication reactions and transports to or from hospitals or nursing homes. I'll say that again. Less than 1% were legitimate emergencies. The rest, the other 99% are what? Medication reactions. Doctors switching somebody's psych med, they freak out, or the blood pressure med is too powerful, they up their dosage, and now they're on 4 blood pressure meds because they went to the doctor the other day. Now they're that 5th blood pressure med that they put them on all of a sudden messed them up, and now it's a medication reaction. Somebody falls over and codes, or somebody calls the cops or calls 911 because of a medication reaction. The rest, the other 99% are medication reactions and transports to the hospital from the nursing home or to the nursing home from the hospital. That's what your taxpayers' dollars are going towards for all the ambulances and all the crazy stuff that's going on in the EMS. Crazy, huh? Remember, this is 2016. A paramedic told me he gave Narcan 10 times a week in Hamilton County. And he is only one of dozens of staff. His workforce of about 120 people commonly has the same stats as him. So if you take 120 people working and they're each jamming Narcan 10 times a week, do the math on that. That's sick. 80% of them actually were coded from opioids. My point, oh my God, that's Chattanooga. That's Chattanooga 7 years ago. Has it gotten better or worse? Depends on where you go, I would say, but think of big cities. Think of Detroit, think of LA, think of New York, Chicago. Oh my God, it's unbelievable. Where's all the opioids coming from? So now let's compare to 2023. I did a little recon the other day, called up some friends of mine. These stats are for Bradley County. I was given permission to share all this, so don't come at me. 22,000 calls and nearly 600 true emergencies so far this year. 1 or 2 calls per day are now true emergencies. So we went from 10 true emergencies a month to about 60 or 70 true emergencies a month. 7x, right? Some calls have increased dramatically, such as respiratory. Why do you think these have gone up? I don't know. What they're spraying on people, all the crazy crap out in the air that they're spraying. Infections from open wounds, probably what's in their bodies now, is what I'm thinking. And weird fungal growths. Where would weird fungal growths come from? Food, drugs, yes, but all the crap they're spraying. Remember the smart dust in the, what was the name of it? Look up in the sky, it's a bird, right? Cardiac calls are running hot. Each day, 6 or 7 trucks are running 10 to 12 calls per hour, per 12-hour period to cover a county of 120,000 people. Overdoses have dramatically increased, especially around the time when government checks come out for disability, welfare, and Social Security around the first of the month and the middle of the month. Sound familiar? Yeah. Didn't know that. I said, are you kidding me? He goes, no, man. All emergency personnel know this pattern. You come, you drop somebody off at the, you know this? Jesus. I had no idea. You come, you drop somebody off at the ER, and the nurses are like, oh, yeah, 15th of the month. 6th one we've seen today. Because the government, who supplied the opioids, printing the money, which we've talked about in the Bitcoin classes, the root of all evil, and then handing it all out to the disability, welfare, and Social Security cats so they could go buy their drugs and stay addicted. Perfect, right? If there's one class that might get me shot, it might be this one. But, and he told me a story. One patient died and was revived 4 times in 24 hours. So died, Narcan, woke up, died again, Narcan, woke up, died again. That's a long day. She's a rock star, dying 4 times in one day, and I thought it was work just to die once. It's crazy. So let's check this out. Oh, we got a break? All right, and then here comes the medicine cabinet stuff. So get your cameras ready. Sam, go for it.
Alrighty. This patient said, I work in a factory and recently had an accident involving a very large drill that was intended to cut through steel, taking a huge chunk out of my hand. Before Divine Design, this would have been a hospital visit for stitches, or at the very least, a visit to urgent care to figure out exactly how to close and care for this wound. Thankfully, my wife and I quickly contacted Divine Design and were told we could avoid that awful process. We were given a specific type of bandage to hold the wound closed and supplements to help prevent infection and help heal my body faster. We were also able to rent and use the cold laser to help further speed up healing. In just a matter of days, the wound was closed enough that we could begin using the recommended essential oils. The accident happened on a Wednesday, and I was able to get back to work by the following Monday. In less than 2 weeks, I was able to resume all normal activities without even having to wear a bandage. We were both shocked and thrilled at how quickly this wound healed. So it's very fitting.
What'd you say?
Very fitting of what we're about to look at.
Yeah. So yeah, that would have been stitches for sure. No, it's not steri strips. There's other stuff that you can use that are much better than steri strips. And we can talk about that farther down the road, probably in a part 2 maybe. We didn't get to the traumatic stuff, and that's some stuff that I'd have to be careful of with liability, but it's stuff I'm willing to talk to people about, just maybe probably not on camera. The people who profit from you being sick are not trying to heal you, FYI. Just FYI. They're not spending millions of dollars to give you a free vaccine because they love you. They're not. The myocarditis means it's working. little elf. I want to bash him. Anyway, government is a disease masquerading as its own cure. Correct. Our society, so dumbed down and indoctrinated that anyone who's a critical thinker is perceived as a conspiracy theorist. And I would put in there, my pronouns are told you so. We should edit that one. Yeah, we should edit that. I don't spread conspiracy theories. I share headlines 6 months ahead of time. Oh, Lord. All right. So here's a list of popular Rockefeller medicine petrochemical poisons that are currently in your medicine cabinet with a natural alternative, such as aspirin, acetaminophen, ibuprofen, hydrocortisone cream, antihistamines. You might want to take pictures of all this. This is stuff in this column. I would say this is how it's used to treat. Aspirin is used to treat inflammation, fever, pain, stuff like that. Stupidly, don't pay attention to this. This is just to explain what these are. This right here gives you options. Like sometimes I put many. It's like there's a lot of things that we use here that could replace aspirin. 2 of them that are good, that work nearly for everybody miraculously, are these 2. If it's just pain, if it's just stuff that you're trying to get rid of, or I shouldn't say trying to get rid of. If you're trying to numb the pain, you know.
Is that a standard process?
These are Mediherb. So mainly, we've got a ton of stuff here: liquids, homeopathics, liquid or herbals, botanicals, liquid and capsules, tablets, liquids, whole food supplements. We've got a ton of stuff here. We've got humic and fulvic acid stuff. We've got Whole Food, another company that does whole food. We've got all kinds of stuff. Liquid homeopathics that are water-based, liquid homeopathics that are alcohol-based. We got all kinds of stuff. I just put down basically what I'm trying to do here. We're only keeping it like standard process and Mediherb. There's just too much stuff. I could list probably 400 products that would replace your aspirin, your acetaminophen, and your ibuprofen. What do? We test and find out what would be best for your body at that point in time, based on your food, based on what other stuff you might be taking. But these are 2 that are across the board, always great. Then the hydrocortisone cream. How do you replace that? We've got a few options here: liquid herbals, drainage remedies, ionic detox, cold laser. Somebody gets poison ivy, or they get bit by a bunch of bugs or a bad spider or something like that. Foot spas work like a charm. Why don't hospitals know how to use light and water and heat and electricity? Because they only want to poison your blood. That's it. Antihistamines, same stuff here, at least for the skin. Skin stuff, homeopathic liquids, USF, we'll talk about that later. We'll talk about the chlorophyll. I'll show you what all this stuff is. But right there, that's one thing that you might want to know. Oh, and aspirin, by the way, everybody says, oh, chiropractors, you're not supposed to pop your knuckles, yada, yada. That whole idea was created by a company named Bayer, who makes what? Aspirin. So if you don't adjust and move your knuckles and they rot, you're eventually going to have what disease? Arthritis, for which you're going to take what? So if I was a bad guy, I would create some bad press regarding moving your knuckles, and everybody would have arthritis within a generation. And that's exactly what happened. Still to this day, I get asked about that because somebody's grandma learned that 100 years ago, and they still talk about it. But thanks for Bayer. Pick a calamine lotion. We'll talk about skin a little bit, rubbing alcohol, get rid of it, use your silver. Unless you're going to use the alcohol for, but cleaning something, cleaning the floor, or, cleaning up, the crime scene or something like that. That's okay. Go ahead and do that. Melatonin, get rid of it. It'll kill you. Right, Sam? Right? Oh, yeah. Melatonin, that crap will kill you. Many, but we've got a lot of nutritional sedatives. We'll talk about some of those later on. And by sedatives, it doesn't mean you're going to be high as a kite. So don't be getting your hopes up. But by sedative, it means it'll calm you down and chill you out so you don't feel like taking somebody's head off. And it's all whole food, right? And some of it's herbal, but most of it's whole food. Thermometer, get rid of it. Why? Because your body, your kid's brain your body isn't going to cook your kid's brain. Get rid of that idea. Get the idea out of your head for your grandkids and your kids that a fever will kill you. Knock it off. Your body's not stupid. They've trained you to think your body is stupid. But ionizable whole food calcium put into your blood, boom, put into your digestive system that then goes into your blood. It's an immune system and blood builder. So the problem is not the fever. The problem is when you reduce the fever, right? We could talk all day about that. I've taught whole classes on fevers. Decongestants, Allerplex, Antronex, Allerco, eye drops. Get rid of your eye drops. Get rid of your Visine. If 1 drop of Visine in your water could make you diarrhea for 3 hours, right? You know that trick, Jonathan? You've played that on a few people? No? You have? 5 people? You played it on 5 people? That's mean, dude. That's mean. Why would you do that? But if a couple drops of diarrhea will make people almost crap their pants instantaneously, what happens when you put it in your eyes? Right? You guys never played that trick on anybody? Make me feel like, now you're all going to go home and do what tonight?
Watch the news.
Yeah. Tums and Rolaids. Get rid of your heartburn and your acid and your indigestion and all that nonsense. Right here, magical. Hydrogen peroxide. I wouldn't say get rid of it. I mean, you could do some stuff with it. We'll talk about that farther down the road. But silver, Vapor Rub, get rid of that crap. My mom tried to kill me with Vapor Rub for years. It was horrible. But you can do Young Living. I only recommend Young Living because that's for internal ingestion through nebulizer, or if you don't have a nebulizer, do a diffuser. If you've got a respiratory thing, turn your diffuser on, make sure the water's clean, make sure the bowl's clean, make sure you're not using tap water when you do this. It's okay to use tap water on the other stuff. But when you just bend over and just take some big long puffs off of your diffuser if you don't have a nebulizer, and clear out, put some good oils in there that are good for clearing out lungs. If you have questions, ask us. But good oils that will clear out your lungs, and you'll never have to have a nebulizer. Okay? That's easy, simple thing that you can do to guard yourself against respiratory nonsense. Like if you do happen to think you caught something, which you can't, but if you poison yourself, nebulizer. Oragel, get rid of it. Herbal throat spray, clove. It's the original dental topical anesthetic is clove oil. Hundreds of years of clove oil up until they developed anesthesiology, right? Bios, Biodent, homeopathic liquids, herbal liquids. Homeopathic liquids and herbal liquids are massively powerful. People underestimate the power of God's plants and the power of frequency in water, right? But they put up on a pedestal the power of drugs. It's fascinating to me. It's crazy to me. Antidiarrheal. Well, let's see. If your body's trying to have diarrhea, it must be for a good reason. So why would you get rid of that? Get it out of your house. But if you do have some stuff going on, that's one option. There are many options, but that's one option. Laxatives, same thing. Boom, boom, boom. Wow, look at this. Valuable list right here, folks. Valuable list. Look at that. Diaper rash. Many. See skin. Right? Sunscreen. Don't use it. Well, what about my kid that's light-skinned and has red hair and blue eyes? Cut your sugar, eat some greens. Nobody ever died of skin cancer up until they started developing sunscreen, right? Cataplex F, calcium lactate. It's impossible for you to burn horribly if you don't eat sugar. It's impossible. Put sugar through an oven. What does it do? It burns. It's called toast. Put a plant through an oven. What does it do? Plants have lived in the sun all day, every day for how many years? They never get skin cancer. So if you have chlorophyll in your blood, you'll be fine. If you have sugar in your blood, you're doomed. Period. Right? Antibiotic ointment? Yeah. Sunburn is a nutritional disorder. People lived in the sun for thousands of years, right? It wasn't a problem until they developed sunscreen, right? Sunscreen was developed and skin cancer went up 70-something%. Antibiotic ointment, get rid of your Neosporin. See skin above, silver, colloidal silver, that's a great thing. I would not buy my colloidal silver in a store for reasons we'll talk about in a little while. And then liquid bandage, this whole list was, by the way, I forgot to tell you this whole list was like the top 20 or 21 things that you'd find in the average American's medicine cabinet, by the way. Liquid bandage or clotting agents like New Skin, don't use it, bad, bad, bad. Chlorophyll, USF, homeopathic liquids, botanicals, herbal liquids. I just put a lot of stuff there because there's so many different people's things might be different. We had somebody a little while ago, I don't know if we have that written down, do we, about the thumb patient? No. But okay, let's move on. I'll tell you, remind me at the end, I'll tell you about somebody who just avoided a surgery last week, 2 weeks ago. So, points of interest. As a doctor, I'm supposed to encourage you to stockpile all that nonsense in that previous table. and as well as all of your prescription medications, just in case the world ends and, things come to a screeching halt. But no, just no. I don't do that. I'm not going to tell you go buy. Make sure you've got plenty of insulin. Make sure you're stocked up. Make sure you've got plenty of this or that. I'm not going to tell you that. See previous events for reasons why. But it's ultimately your decision. But as for me and my house, we have strict policies that all the stuff on that list doesn't even make it in our house. Like it's illegal for us to have that in our homes. Any of the pharmaceutical nonsense. We just don't. We made a rule years ago. We're not doing it. Outside of an emergency room, the term life-saving medication will be heard everywhere. But it's an oxymoron, right? Like peacekeeper missile or government aid, you know what I mean? Decide ahead of time what you're willing and not willing to do in an emergency situation. We already talked about that. What else? The fear of death drives a lot of people to do stupid stuff. Know your God or suffer the consequences. Do not put your faith in pharmacy remaining open or on your dependence upon the above products. And in a grid down scenario, anything that could potentially make you sick could potentially make you dead. So all your drugs, all your Neosporin, all the stuff, anything that's a poison, anything that could potentially hurt you could mess you up, right? Here's something you need to know too. The above products are all originally came from plants. Like the Oragel got its ideas from clove oil. The Neosporin got its ideas from other topical antibiotic ointments, right? Now they're not coming from plants. They're all made in plants. Big difference. Use the above products only in a dire emergency. The above products meaning the medicine cabinet stuff, right? Only in a dire emergency. But I would say use the stuff over on the right. William Osler said this 130-something years ago. He who takes the medicine must heal twice, once from the sickness and once from the medicine. But if you take herbal, liquids, homeopathics, whole foods, plants, animals, you don't have to heal from that. Top 14 fast-acting supplements. You want to know about fast aid? Here it is. Fast-acting, number 1, turmeric forte, healthy inflammation response. Nervogesic or California poppy, they both work synergistically, but one or the other usually takes care of stuff for healthy pain response. Rhodiola and ginseng, for all those people out there just overworked and underpaid. Ginkgo forte, that's the only tree that existed after I'll say whatever happened in Nagasaki and Hiroshima, whatever they say it was. Those were the only trees that were left standing. Very good for your brain, for your eyes, for your nervous system. Zypan, that's your digestive support. We talked about that. Gastrex or ochrapepsin E3, one of the first digestive support supplements made in the 1940s. Royal Lee came up with the first probiotic on the market. He also was the first person to popularize echinacea in the 40s. Nobody in this room heard of it until the 80s, but Royal Lee was doing echinacea back in the 30s and 40s. And then Colax is like a bowel regularity. Most of these are all MediHerb except this one, and this one. The rest are all MediHerb. Colax and then Allerplex and Antronex are those healthy histamine responses. We'll talk more about that later. And then the rest of the top 14, I would put this together and say the rest of the top 14 right here. Cava Forte, if you're if you're going to need something to calm you down or if you're going through a lot of stress. RNA, that's your balance. That's your cerebellum. That's all your balance. That's your concentration, your focus, your memory, stuff like that. Herbal throat spray, that is the only supplement, that is the only thing that acts immediately. That's the only standard processor MediHerb whole food capsule tablet supplement. That's a liquid that acts immediately, but I would say we've got a ton of other liquid things that do act immediately. But that gets right on your throat, right on your tonsils, your adenoids, and soaks in, and you feel it immediately. It's the answer to Chloraseptic. For all those people who grew up on Chloraseptic. Adrenal support, bronch effect, instant lung support. You will feel it immediately. Bronch effect, that's a capsule or a tablet, or a liquid, I mean. And then Ligaplex 2 and Gotocola, the musculoskeletal repair. If you remind me at the end, Sam, I'll tell everybody once the camera's off, because I don't know if she wants me to share her story, but if you remind me at the end, I'll tell everybody about how we avoided surgery with somebody last week. Top 14 fast-acting supplements. There's some good stuff in there, and we can talk more about that later on. If you wanted to do also to have your essential oils on hand, I'll bet you all the essential oils on this list and the next slide would probably cost you, I don't know, $100. They're dirt cheap. They're good for anything. And people need to understand that these are the plant extracts that have been here for thousands of years. People just need to understand that. There's so much crap out there, though. Don't buy your essential oils at Walmart. Do not buy them at a store. There's fillers. There's stuff that you do not, because they make it so cheap, they want people to take poison. And so they'll ride the wave of the popularity of Gary Young and essential oils and all this stuff. And they will ride the wave of the essential oil craze. And then they'll sell you garbage that has stuff in it. The only company out there that is 100% ingestible, Young Living. So I just don't recommend anything else. And if you wanted to watch the classes on Young Living and why they're so hardcore, there's multiple Young Living classes online. But I would say go back and watch Plant Power for the Next Plague. That's where we talked about some of this. Constipation, fevers, fractures, heat stroke. These are topicals. These are orals, oral ingestion, topical ingestion, or in your environment. Diffuse it and boom. I'll talk about some things that you should be using in your environment. There's more. Next slide. Infections, insect bites, insect repellent, jet lag, rashes, sleeplessness, sunburn. Like if you're spraying crap around your house to repel insects, you're missing the point. Like you're poisoning yourself. Febreze, air fresheners, what's the other poisons? Lysol, all the crap you have in your house. You could replace all of the stuff you have in your house, all the chemicals under your sinks, in the bathroom and the kitchen. All of those could go away. Probably with the exception of like Drano or something, just in case you get a fur ball stuck in the drain or something. But you don't need Windex. You don't need Tilex. You don't need anything. Right here. Fixes all of it. Not just these oils, but other products. But yeah, I mean, you can become so dependent. So many people become so dependent on all these chemicals. They have to have Armor All for their car and Windex for the windows and Tilex for the toilet and Scrub and Bubbles for the tub and this and that. It's like, think about the number of things you have in your house. We teach whole classes on how to get rid of everything in your house. How to ditch and switch. Ditch the old crap and switch to something that's not going to kill you. This alone, if you just did this, right there, spray it around your patio, spray it around your front doors, bye-bye spiders, bye-bye all the stuff trying to come in right now because it's getting cold outside, right? Rashes, sleeplessness, sunburn. Sunburn, boom, there you go. You can do topical, you can do internal. And next. Oh, there's more. Look at that. Wow, you guys are getting your money's worth for this one, aren't you? Swelling, toothache. There's the clove. See the toothache? Travel sickness, vomiting, all kinds of wounds. Lavender, tea tree, chamomile, boom. You see some interesting patterns. So there's probably a total of 15 oils, 20 oils there. Each one of them maybe $15. Wow. You could sink that into your healthcare, salvage that back from the premiums you're paying for products that you don't want, drugs and surgery, and become self-sufficient. So notes, we do use oils for in, on, and around, topically, orally, and diffused. Do not buy your oils at a store. Fillers and chemicals defeat the purpose, and if you're taking them internally, you're really defeating the purpose. So you definitely get what you pay for in all aspects of life. Oils are no different. Herbs. Most patients start with whole food supplements, aka plants and animals. When you hear me say whole food, it means stuff God made. Plants and animals in the whole form. The organs and the glands of animals in whole form. There's no other way you're going to rebuild. No other way. That has to be in a form that can be transported from your gut through your blood to the organ that it needs to arrive at. Period. I didn't write it. He did. But then patients, once they get healthy, then a lot of times some of their whole food supplements will go away and we'll just move them over to herbals and homeopathics. Herbals and things that, and homeopathics that stimulate, as we'll talk about here in a minute. Remember, whole foods rebuild organs. Herbs gently stimulate. Like ladies, if you're talking about your hormones and your neurotransmitters, neurogenesis, you're talking about your hair falling out, this and that, how do we fix that? We fix it by rebuilding the organs. We rebuild your hair follicles, right? How do we do that? Through your bloodstream. And herbs gently stimulate. So once you get it rebuilt, you can gently stimulate it through herbal stuff and homeopathic stuff. Herbs are not essential nutrients to the body. Some interact with actual medications. So when people always ask me, or years ago, I used to get people showing up to my classes saying, here, you got to try these oils. You got to try these oils. You got to rub them on your feet, and it fixes fibromyalgia and constipation, irritable bowel. I'm like, no, it can't. It might help, but it's not going to fix. Putting oils on your feet is not going to fix fibromyalgia. The mechanism behind fibromyalgia, the mechanism behind irritable bowel, the mechanism behind whatever the case is, you cannot just fix it by rubbing something on your skin. It just can't happen. It might help, might alleviate the pain, but the herbs and many times the oils are not essential nutrients to the body, right? And if you're going to put somebody on or if somebody's going to go down to the store and buy a bunch of herbs and they're on 15 medications, they can have problems, right? Herbs have, like the people we put on herbs, remember, when people start out, they're on whole food supplements. Farther down the road, after they've weaned themselves off the 15 drugs that they were on when they first walked in here, guess what? They're not on drugs anymore. So what does their body start asking for? Right? Because they're no longer on drugs. Not that I took them off. They took themselves off because they didn't want the crap to begin with, which is why they showed up here, right? But herbs have phytochemicals like essential oils, flavonoids, tannins, resins, bitters, pungents, saponins, coumarins, alkaloids, phytoestrogens. So herbs have a lot of good stuff in there that your body uses in a different way than it uses whole food supplements. And we use all this stuff here. And oils are completely different than just herbals. Oils are plant extracts. They're not herbs. Next. You use the stem, the root, the flower, all kinds of stuff. Herbal company, we trust MediHerb, the leading healthcare professional only herbal company in the world. Thousands of years of research are available to you from the best companies who have the equipment and the experience. People always ask me, hey, can I just grow my own? Yes, you can on your own, but it can be problematic due to space, seasons, animals, preparations. We all have to trust somebody. These guys have been doing it for a long time, and they're standing on the shoulders of giants that did it for hundreds and hundreds and hundreds and hundreds of years. Like Royal Lee, I guess you could, harvest your own beef spleen. But do you really want to? And is it going to be cost effective for you? You know what I mean? Next. Remember, though, we usually do not use protocols. A supplement for a symptom is the same philosophy as a drug for a disease. Your body simply does not think that way. That, oh, I've got this disease, I need this drug. Your body does not think, oh, I've got this symptom, I need this supplement. That's not the way it works. So like when people come in, they go, hey, doc, you got anything for tired feet? I mean, yeah, but it's not the tired feet thing. It's the physiology of your muscles, right? Or people say, oh, I got a headache. Well, that could be a ton of things. That might be a ton of things. There's not like, oh, there's this magic supplement for a headache, like there is a magic supplement, like a magic drug for a headache. It doesn't work that way. You got to figure out why the headache is there. Why do your feet hurt? Why is there pain in your organ, right? So once you figure that out, it's easy. But we don't do protocols. There are simply some of the many options available for you to consider. These are simply some. This should illustrate our ability to help you in absolutely every instance. So let that fear go of something bad happening to you. You're never going to get a cancer diagnosis. You eat the right stuff. You do what we tell you to do. You take the right stuff. You're never going to get some big crazy diagnosis. It's physically almost 100% impossible. You get off your meds on your own time, on your own dime. You do that. You eat the right stuff. You detox. Your body will just not. You're not going to have some crazy toxicity problem like cancer. Using muscle testing, we help to determine the most effective option and dosage for each patient. And you can never be wrong. When you're using whole food stuff that can't poison people, you can only be more right? Next. Everything we use is safe for pregnancy, lactation, infants, toddlers, old people, young people, tall people, skinny people, fat people, doesn't matter, and feeding tubes. Principles. We only do ancient, safe, effective, valuable, empowering stuff. You're being empowered right now by sitting in this class because you're learning to think differently and ask different questions. Because all throughout your life, you've asked the same questions and gotten the same answers as so many other people. They ask, well, what do I do if I do this or that? Well, you go to the hospital. We're having you ask a different question. I wonder if I could take care of this myself, right? Why am I dependent on these people, right? So, last little bit right here. We're going to do another commercial break and then we're almost done. But get your cameras ready because we're going to do the protocols we never suggest. Ready, Sam? Yeah. Fabulous. I'm parched. I'm talking a lot.
All
I'm trying
right.
to get through this quickly.
I know. I'm going to take your place for a second. All right. This patient said, I had severe pelvic pain that made it excruciating to sit, walk, and stand. After coming to Divine Design for an adjustment, nutrition appointment, and supplements, the pain decreased from an 8 to a 4 in a couple days and to a 1 after a couple more days. I refused to go to the emergency room or see a medical doctor because I wanted to go the natural route. What a blessing to have Dr. Brett to offer natural options.
Yes, fabulous. We just want to keep people out of the medical meat grinder. It's weird how quickly the mainstream media was able to pull together a daily death counter for COVIDs, but they just can't seem to compile the data as efficiently for COVID's deaths and lethal injection reactions. Almost like they had an agenda to terrify people into compliance. Almost. Crazy, right? Lethal injection is a monstrosity. A misbegotten offspring, this is 130 years ago, by the way, a misbegotten offspring of error and ignorance, and being such, it should have no place in either hygiene or medicine. Believe not in vaccination. It is a worldwide delusion, an unscientific practice, a fatal superstition with consequences measured today by tears and sorrow without end. It's 130 years ago. Not everyone is a vaccine head. And they weren't back then, too. There were many people sounding the alarm back then. What changed in the last 30 years? Gee, I don't know. ADHD went up 900%. Alzheimer's went up 300%. Autism went up 2,100%. Bipolar disease in youth. Why are youth being considered bipolar? Because they met with a psychiatrist. That's why. 11,000%. Celiac disease, 1,000%. Chronic fatigue, 11,000%. I mean, this is ridiculous. But see, people will still argue with you. And they will say that my doctors are helping me. I talked to somebody today. Somebody today said, yeah, my friend thinks her doctor's helping her. And I said, well, you just told me she's going to dialysis. Her doctors have been helping her for how long? Oh, years. So she's been on diabetes drugs for a long time. Why isn't the diabetes gone if the doctors are helping her so well, right? No, the doctors see her screwing her up, and now she's got to go to dialysis. I forget who that was. Was that you telling me? Who was that? That was you. So you got a friend going to dialysis, and that's swearing by the doctors, helping her. Well, she's been on the drugs for diabetes for how many decades? And this is exactly what's going on. It's not just her. I'm not griping about her. I'm saying this right here. Now, are the numbers right on? I have no idea. But I do know this. Every one of them went up. None of them went down. Amen or amen? So you've got every doctor, every nurse, every healthcare practitioner out there. You've got urgent care centers, walk-in clinics, ERs, hospitals just for kids. You've got nursing homes. You've got healthcare everywhere. Everybody's got 12 different types of insurance, right? But they're still sicker than... We are the worst country in the world for healthcare. You know that? So tell me, show me all the doctors that are doing it right. Show me. Because everybody that comes in here, hell, I wrote 8 classes called Lies Doctors Tell, just on what patients were telling me from their doctors. It's unbelievable. Some of them vets. Look at that. That doesn't stop. None of them are going down. People will fight you on it. Next. And here's why. It all fits together, doesn't it? Big Pharma pays doctors, researchers, politicians, the FDA, med schools, lawyers, lobbyists, media, celebrities, big tech, all of them. Because where does this come from? Oil. That's why it's called the petrochemical pharmaceutical industry. Petrochemical. Next. This says things your government protects you from. Pesticides? Nope. Heavy metals? Nope. Seed oils? Nope. Forever chemicals? Nope. Aspartame? Nope. GMOs? Nope. Fluoride? No. They actually put it in the water. Synthetic food dyes? Nope. Microplastics? Nope. Chemtrails? Nope. Raw milk? Yeah. We got to protect you from the raw milk.
Yeah, that's right.
Think about all the nonsense the government did in the last 3-4 years. Well, all the crap they've done in the last 150 years. But think about the last 3-4 years. Instead of making everybody wear masks and get an experimental lethal injection in their arm, they could have told people go exercise, get out in the sunlight, go do this, go do that. They could have taken the fluoride out of the water. They could have stopped spraying pesticides on all the food. They could have done a million other things. What'd they do? They forced you to get a shot in your arm and told you to wear a diaper on your face. That's your government. But no, stay away from the raw milk. While they're spraying chemtrails all over the place, they call it geoengineering, we call it chemtrails, then they're telling you it's climate change. That look I give to obese, mask-wearing, triple jab normies who advise me on being healthy. You guys aren't laughing? You guys don't know who that is? Okay. All right. So what's his name? I'm drawing a blank right now. Guillermo, he's a famous Spanish actor guy from, I forget his name. You guys don't know? Nobody in here knows? Ah.
From No Country for Old Men.
Yes.
From what?
No Country for Old Men, but I cannot remember his name. Moving on. I'm from the government. I'm here to help. Terminator, Skynet. Oh my gosh, yeah. Oh, next. Oh, and this, yes. How you can tell if your memes are reaching your target audience. I'd never seen that one before. Very good, very nice. The protocols we never suggest, here goes. If you got some immune system things that you want to watch out for, there's your standard process stuff to have, there's your MediHerb stuff to have. Colloidal silver, boom. We're just going to peel through these if you want to take a picture of stuff. Oh, black cumin seed forte, that is one of the most important airborne allergy herbs right there, FYI. Cancer protection, there you go. Eleuthero has another name. Some people call it Siberian ginseng. If people are just scared to death of cancer, I just tell them stop poisoning yourself. Next. Simplified, if you got a short-term thing going on, you feel the tickle, you feel something coming on, boom. Take those. If it doesn't work, take more. If it doesn't work, take more. If it doesn't work, take more. The only way it will not work is if you don't take enough. Like if you've got a bacterial thing, I will say. But some people will never be able to tell the difference between a bacterial thing or just poisoning. What if they were at an Airbnb and sucked down Febreze off the pillowcase for 8 hours? They're going to wake up with a crappy throat. They're going to think it's strep. It's not strep. You just sucked a bunch of chemicals. So these are just things for, if you want to support yourself. It's not, we're not saying this is going to fix every sore throat. Simplified soothing support. There's that Broncheffect Phytosynergist. I would say the liquid. Herbal throat spray, fast acting, sinus forte. Get the drainage going out of your sinuses. Get all that crap out of your body. Simplified recovery. If you're recovering from something, astragalus, that's a fabulous adaptogenic herb. Cat's claw forte, same deal. Ashwagandha, adaptogenic herb, fabulous stuff. Simplified recovery. Injuries, burns, lesions, ulcers, wounds. You put this stuff on, it will stain your clothes. Gauze dressings and bandages. MediHerb liquids. I would probably evaporate some of the alcohol out of some of these liquids before I put them on lesions and ulcers and wounds, but they'd be great. Put them into pastes, put them into like tallow or put them into coconut oil. MediHerb tablets to regrow. That's what we're doing to regrow some people's tendons and ligaments and skin as we speak. And we rebuild skin with the Dermatrophin PMG. We'll go through the PMGs here in a little bit and I'll tell you what those are all about. Topicals, USF, sesame seed oil, wheat germ oil, linum B6 applied topically to help you avoid scars, burns, lesions, ulcers, wounds, things like that. Punctures. No, you don't need a tetanus shot. No, I don't care if it's a rusty nail. Injuries, broken bones, Oztrophin, Ligaplex 1 and 2, calcifood. Put somebody on that, pulse them, laser them, broken bone, gets better. MediHerb, bone complex, turmeric forte. It's fabulous. Now, if something is angulated and triangulated and poking out of your skin, it's a compound fracture, something like that, get out of here, go to the ER. And we'll talk probably, maybe in part 2 of this, farther down the road, we'll talk about what we would do with stuff like that, like broken bone. We'll talk about it. What happens? Somebody stumbles in here at the end of the world, Mad Max, chased them down and shot them, and now they've got a bullet wound in the leg or something like that. We'd talk about what we could do. Insect bites. Antronex. See, the problem with insect bites is it gets into your skin. You get injected with poison, much like a lethal injection, right? But the lethal injections are fine because they're free from the government. Remember that. But you get a snake bite or a bug bite or something, and people are going to put ice on there, which does what? Stops the blood flow. Stupid. All your ER people and all your coaches and all your PT people are going to tell you, you injure yourself or you get a bug bite or something, put ice on it, right? It's what we were all taught. It makes no sense. If you remember and you believe and you know how the body works and how blood flows, it doesn't work like that. You want the blood to flow, right? So what would we do? we'd use this and this and this to get the blood flow and the drainage channels open up to get your body to pump out what? The poison. You don't want to keep it in. Very similar to like poison ivy, poison oak, poison sumac. You want to pull the stuff. You want to put them in some situation where something is going to create an ionic field to yank that crap out of their body, and then give them nutrition that acts immediately, right, in their body as soon as it gets into them. Give them nutrition to get it out. Open up their drainage pathways. Open up their lymphatic channels, right? So they pee, poo, breathe, and sweat, all of it out. Next. Digestive issues. Standard process makes 4 or 5 different digestive enzymes. There they are, Medier, boom, boom, boom. Remember, these are only 2 companies that we're using, but there's 10 more, 12 more, probably 8 more. Next. Respiratory issues, lung damage. If you got COPD, asthma, something like that, you need some of this and you need some of this. Allergies. Well, allergies aren't allergies, as you should watch the You Don't Have Allergies class, but what people call allergies, boom and boom, that'll help immediately. Fabulous. Sunburns, talked about that already. Just any number of other topical liquids, essential oils, homeopathic creams, just as tested for each case. Some people might need something else, depending on what their body's just deficient in, right? They're going to test for different things. Standard process for the pain stuff. We've got multiple pain things. People come in, they're getting better. All of a sudden we hit a brick wall. Oh yeah, well the pain was getting bad, so I took a Motrin or a Tylenol or this or that. Remember, he who takes a medicine has to recover twice. Once from the medicine and once from the problem, right? So we have solutions to things. The only reason people don't know about them is sometimes I forget to tell them. I think everybody knows this stuff, but really it's our fault. We don't tell people enough. But they don't think that we have solutions for things, but we do. Teeth. Ask your dentist for a supplement that will help regrow your teeth. He'll look at you crazy. Simple when you understand health and nutrition, when you understand standard process. Royal Lee was a dentist 120 years ago. He was born in 1895, right? 130 years ago. So he was a dentist. So he understands teeth. Weston A. Price was a dentist. Medier, pain stuff right there.
Are those 2 things for teeth? Are those herbal things that you take?
No, those are whole food supplements.
Whole food supplements.
Next, heart problems. The E2 factor is the first vitamin destroyed in the commercial milling of flour. So when people eat a lot of wheat and flour, what are they doing? They're killing their heart, which is why heart disease is the leading cause of death in the world, right? So see, they eat themselves, they dig their graves with their own forks, right? So when people are eating bread and cake and candy and pasta and noodles and rice and all this grain crap because they think, oh, Jesus is the bread of life, Well, bread is very different than it was back in the day. Back then, it wasn't genetically modified. Back then, it wasn't sprayed with pesticide. Back then, when everybody ate bread, they worked outside all day long in the sun, so they were eating up that sugar, because bread is all it is sugar, right? Cardio Plus would revolutionize every medical heart center in America, but you'll never see it. Cataplex B, go back and watch We Heart You 2 for the solution to every single heart problem, every one of them. Nerve motor conductivity problems, they will take you to the ER, they will do an EKG, an echocardiogram, an electromyography, or a nerve conduction velocity test. People with carpal tunnel will know what these 2 are, these last 2. EKG, that's for your heart. EEG is for your brain. But any nerve motor conductivity problems, such as seizures and muscle spasms, are simply, I want you to remember this, simply a lack of B vitamins and dietary fat. What's your nerve made of? Fat. How does the electricity impulse travel down the nerve? Nerve motor conductivity problems, such as seizures and muscle spasms, are simply a lack of 2 things right there. That's it. Some seizures, yeah, it's too easy. It's too simple. People don't want to know that. They want to go to specialists. They want to have images. They want to have a handicap placard hanging in their rearview mirror. Sleep. You having problems with sleep? There you go. You don't have to do all those, but those are options. The number 1 reason people come to us, sleep. Number 1 reason. They can't sleep. Number 1 reason. Crazy. They don't come for pain. They come because they can't sleep and they can't get up in the morning. They're about to lose their job, right? Oh, yeah. I was going to discuss all this stuff, but yeah. Go back and watch the old one. Pre-surgery, here you go. I'll tell you this, 3 months will take 1 month with us. You've only heard of rehab after an injury. You've never heard the word prehab referenced before an injury in order to prepare for surgery. Why? Medicare won't pay for it. That is a direct quote. This is because Medicare does not recognize or reimburse. That is this right here. I heard that. That's a direct quote from the Indian surgeon that worked on my dad. Right there. I thought, wow, that makes a lot of sense. I got to tell people about that. Never heard that before. Cataplex AC. It's vitamin A. It keeps the mucous membrane healthy. Vitamin C prevents infection, bolsters collagen. See, vitamin C, everybody's been told, because of emergency and the powders and all the stupid stuff people take, that vitamin C is for your immune system. No, vitamin C is collagen. That's how it got its name. Vitamin C, look at it. Vitamin collagen, right? But it is an antioxidant. It helps with the bolsters your infection and stuff like that. Calcium is what you think is vitamin C. But that's a long story. Cataplex ACP is the above combined with rutin or rutin factors to support the blood, the skin, the connective tissues, general resistance to infection. And then scars, of course, wheat germ oil on exterior and gotu kola on the interior. This is facelift in a bottle, gotu kola, wheat germ oil on the exterior, covers up, or doesn't cover up, but helps your body heal from scars along with laser therapy. Next, that's why we use laser. EMF and radiation protection. You want to get away from the 5G stuff that's going on? Do buckwheat in Saruta, Saruta Plus, and Easy Mag. Along with turmeric forte is the most important combination. Turmeric forte, we talked about that earlier. That was for like inflammation response. But remember, inflammation is not the problem. It's what's causing the inflammation that's the problem. You just want the turmeric to be able to have a proper inflammation response, but you should probably remove from your body whatever is causing the inflammation. Buckwheat protects the blood-brain barrier. You got ginkgo, Herbovital, the other stuff that ginkgo is in, Mediherb products, Herbovital, ginkgo forte, gotu kola complex. And you can diffuse rosemary, young living in your environment. That's in a few of the Mediherb products. Other fast aid solutions. Here's a home run game changer right here. This is all standard process stuff. Okay, so if you're going to build your medicine cabinet, these are other things you might want to have. If people knew that there were natural diuretics, would they get rid of their diabetes drugs? Or I shouldn't say diabetes. Would they get rid of their blood pressure drugs? Natural diuretic, which also happens to take care of a lot of nightmares, by the way, for reasons that we won't talk about here. Allerplex, respiratory, we mentioned that. Antronex, natural antihistamine, drainage, we talked about that. Beta food. If people have, who was that today? I can't remember. One of the first surgeries that we have, right after I went into practice, a few months into practice, somebody came in and had a gallbladder problem. They wanted to cut him. I said, no, take 6 of these, 12 of these, whatever it was. I can't remember. And a couple days later, he was fine. Fat digestion, gallbladder issues. Why? Because you eat crap food long enough and your bile gets thick and you build up gallstones, and then they're coming to rip out your gallbladder and your appendix, like in that first testimonial that we had. Boom. Calamo. Everybody's all about going alkaline because they read some stupid book from a health food store 40 years ago and they're doing alkaline water. Then they're wondering why they get calcified stuff and bursitis and joint pains and infections, because you're trying to change the pH of your body. Calamo reverses it. Calcifood, that is a bone broth. Everybody's on the bone broth kick right now. This is better than bone broth because it's not heated. All 22 amino acids. Roy Lee was so far ahead of the curve. OMG, he was so far ahead of the curve. You got Axe and everybody out there selling bone broth by the ton. It's all heated, right? Calcium lactate, ionizable whole food calcium for tissue diffusion and rapid immune enhancement. Calcium lactate, that's what everybody thinks, vitamin C is doing, but vitamin C is collagen. Calcium, immune enhancement, teething, infections. You have a fever because your body's trying to raise the temperature in order to cook the bad guys, right? And what's it doing to raise the temperature? It's pulling calcium out of your bones, growing pains, and it's pulling calcium out of your teeth, tooth decay. So if you don't have enough calcium in your blood, your body will pull it out of the reserves of your bones and your teeth. Crazy, huh? put enough calcium in your body, and the toothing pain goes away, the growing pain, bone pain goes away, and you got enough calcium to fight off infections. Next. I would say you should have, every single person in this room should have like this in your arsenal. That's why we remember, that's why we did the 10% off stuff between now and Thursday. Cataplex B, nerve conductivity and stimulation. Remember the heart issue thing? Cataplex C, collagen formation, tendons, bone, teeth, skin, arteries. What are your arteries made of? Collagen. What's your skin made of? Collagen. Cataplex E2, that's the Cardio Plus thing that would wreck heart centers. All of them. It would wreck them, or Cardio Plus. But they just don't want to know. Muscle spasms, heart issues. Because see, the E2, remember, it's pulled out of the wheat when it's refined, the flour when it's refined. So everybody has these nutritional hang-ups, these nutritional deficiencies, which manifests as heart disease because the heart eats first, but it's not getting the stuff it needs. So they put it in the Cataplex E2. You reverse the muscle spasms, the angina pectoris, and the heart issues overnight. Cataplex G relaxes nerves, sleep aid, natural vasodilator. If people knew there was a natural vasodilator, right? Their blood pressure meds are vasodilators, right? Just like the diuretics, because they want you to pee out fluid so your blood pressure goes down, so they give you a diuretic. They want you to take a vasodilator to make your arteries big so that your blood pressure goes down, because they're just looking at a number on a screen. They don't care about how you feel, because nobody ever left a doctor's office saying, oh, I finally got the right diuretic, right? The doctors just go, oh, your blood pressure looks good. Yeah, but I still feel like crap. Yeah, but your blood pressure looks good. Yeah, but I feel like crap. Yeah, but your blood pressure still looks good. We got you on the right drug, right? Change it. Change it right now. Your body responds to nutrition instantly. Just ask your doctor why he gave you the nitro. Chlorophyll complex, blood builder, pain modulator, topical for lesions. Collinsonia, people are all day long going, I didn't know there's anything you could do for hemorrhoids, varicose veins. Among many options, Collinsonia root. Conjuplex, immune stimulator when you first get the tickle. Next. Saruta, capillary fragility. What is that? That's where your body breaks down, your blood vessels break down, right? Black bags under your eyes. You got very thin skin right here, right? And that's where it shows up first. Easy bruising, pink toothbrush. Doctors call it, dentists call it gingivitis, and all the commercials call it gingivitis, right? But you can fix that. Capillaries, the capillary fragility means your capillaries are fragile, right? So you're brushing and you're popping capillaries, you're bleeding, boom, you fix it with Saruta Plus. Drenamin, that's your anti-stress, your adrenal support, your Fenco, that's if you got some constipation going on. Expectorant for lung and sinus mucus would be fenugreek seed. Increases milk production too, ladies. Use that plenty of times. Gastrex, heartburn ulcers, so we talked about that. GI Adsorb, this is a new one that came out a couple of years ago. Hardcore. What they did with this product is phenomenal. It's crazy what they did with that. But diarrhea, food poisoning, it's a binder. It's a heavy-duty binder. Immuplex, immune issues, immunotherapy drugs, we talked about that earlier. Put these on your list. Make your Christmas list. Ligaplex 1 and 2, ligaments, tendons, strains, sprains. Remember, strains and sprains never even ended up in the emergency room. Not on the top 20 list. It's crazy. Minchex, natural physiological tranquilizer, stress and sleep. You want to pass out? Can't pass out? Take a handful of those. You'll pass out. Phosfood, if you got gout, bone spurs, stones, bursitis, stuff like that. You're restoring the balance of calcium and phosphorus in the blood. What does that do? Melts away all the bone spurs and the stones and the bursitis. All you frozen shoulder people out there, right? But how do they fix frozen shoulder in a hospital? It's called manipulation under anesthesia. What do? They put you out and they go, that's how they fix your shoulder. USF ointment, I already talked about that, but that's all your essential fatty acids. On topical, so that it gets pulled into your skin just like your hormone replacement cream, you know? That's why do they do that? Because your skin is porous. You can get stuff into your bloodstream through your skin. Just ask any woman who dyes her hair. Wheat germ oil, that's standard. USF is standard process. Yep. Wheat germ oil, Zypan, questionable food sources. I use this with a lot of missionaries. They go to overseas, well, because you'll never see anybody sicker than a missionary, because the devil stands at the border of every country. You have to have vaccines, right? And they all do it because they want to be a good boy. They don't want to break the laws. So everybody, every missionary, Every evangelist that travels overseas that comes in here gets on Zypan. Last but not least, quickly, what time is it? Oh, perfect. All right. I'm getting you out by 10. That's great. 22 protomorphogen products for organ-specific support. Good grief. If you have a heart problem, I'm just going to list them all down. So if people have organ problems, how are you going to rebuild the organ? Heart, skin, adrenals, liver, hypothalamus, mammary glands, muscles, nerves, eyes, testicles, bones, ovaries, pancreas, parotid glands. Nobody knows they have those. They're right here. Pituitary, lungs, prostate, kidneys, spleen, thymus, right here, thyroid, right here, utrophin, that's your uterus. For all you guys of 2023, uterus. I give that to all my trannies. So 22 protomorphogen products, this is a standard process only. Royal Lee figured out a way to separate the genetic material, the PMG, from the cellular matrix, from the cytoplasm. That's what this is. So it's not only a rebuilder of certain organs, but it's also a decoy duck. I went into that in the What's in the Supplements class, so go check that out. MediHerb, what's in the supplements class? That one. MediHerb herbal tablets, capsules, and liquids. This is like bottom level. This is what you should have in case the world's falling apart. You want to make sure you got all your bases covered. Andrographis, numero uno. Oh, I had a pick in there earlier. Numero uno for like short-term, heavy-duty immune support. Artemisinin, that's one of our most potent chronic things. That's your Lyme patients. That's your stuff that's killing people. Ashwagandha, it's got skull cap. It's got, I put the main ingredients in each one, top 2 or 3. So this has got Korean ginseng in it. This has Astragalus, Echinacea, Eleuthero root. So you got Siberian ginseng root, right? Berberine, black cumin seed, heals all but death. Black cumin seed oil, it's one of the baddest things out there. Echinacea premium, remember, Royal Lee was talking about this back in the 30s. So there's your short list. Oh no, I think there's another one too. Short list of MediHerb stuff right there that everybody needs. Just in case of emergencies. The tranny zombie apocalypse is upon us. I would say get your stuff. Make sure you're ready to rock and roll. Viranon, what do you think that's for? Poison, right? Getting rid of poison. Viranon, says it right in the name. Last but not least, here goes. Summary things you need to know. You cannot eliminate exposure to all environmental toxins. The reason that most people go into the ER, food and drugs, environmental toxins, right? You'll never eliminate exposure to all of it, but with what you learn here, you can greatly limit your exposure. You cannot eliminate your exposure. You're surrounded by the food and the air and the water. The government's poisoning everything, right? You can't eliminate it, but you can limit it while flushing out what has been previously stored. There's a field, a new burgeoning field of like psychoneuroimmunology, it's called. I'm just beginning to recognize the connection between emotions and physical maladies like allergies and immune compromise like colds and flus and infections and cancers and this and that. So your emotions is a big thing. Remember, September 18th, 1895, chiropractic started. What did D.D. Palmer say? Thoughts, traumas, and toxins, right? Thoughts, traumas, and toxins. Today, you would say emotional stress, physical stress, and chemical stress. That's what we're talking about there. Exosomes and bacteria have a tendency to hibernate along the spine, so when the immune system is compromised, pathogens can manifest into symptoms of illness. You run to the doctor says, oh, it looks like shingles. Let me give you a shot. Diffusion of essential oils is one of the best ways to prevent the spread of airborne pathogens and a lot of other poisons. Oils can latch onto this stuff and neutralize. Plants and animals versus plant-based foods made in a plant. This is what old Billy Boy is trying to kill everybody with now. The plant-based foods, we do not want those. You want plants and animals. You do not want plant-based. Remember, this is why we're here. We're another Clydesdale, right? You're a Clydesdale. You, by yourself, can pull 8,000 pounds alone. But when you put 2 people together and you harness side by side, the 2 horses can pull 24,000 pounds, totaling 3 times of what you could do alone. Let us help you. Do you have any questions? Was that a lot of info?
Yeah.
A lot of info, I know. We had to boogie. We had to boogie because we had to get through all of it. I'd rather go too fast and have you guys have this resource to go watch online at home on your own time rather than not give you enough info. Question, we got a microphone. Microphone, hold on. Microphone. Say what now?
Some of the PMG products, which I think she is taking, one of them, it's porcine. You know, are we supposed to consume pig? I guess.
It's up to you.
Does it matter? Well,
I don't eat pig meat, but there are certain organs that a pig has that no other animal has.
okay, so
Certain interesting things that pigs do and have. I wouldn't eat the meat, but would I take some porcine stomach in a supplement?
okay,
Yeah.
that's my question.
That's up to
is
you.
it-
It's up to you. Some
Okay.
people are very, very anti about
I'm
that.
just wondering about the biblically clean aspect, you know, and we kind of hesitated at first, but we went ahead and
Depends
took it.
on if you're mainly OT or NT. Depends on what people read. There's some
Okay.
people that wouldn't touch a pig for anything. There are other people that go, well, I read the New Testament and Paul said this. So depends, right? I mean, I wouldn't be eating pigs. I wouldn't be eating bacon and sausage, and pork chops. I wouldn't touch that crap if you paid me. But a pig's stomach is very interesting. A pig's small intestine is very different than any other animal's small intestine.
How so?
Because what they eat, the digestive enzymes they have. They could break down rubber. They could break down concrete, for crying out loud, right? Their stomachs are nuts, out of control. So the cells in a pig's stomach are very interesting dynamics, very interesting mechanics in a pig's stomach cells. So if somebody's having some really, really, really hard times with digestion, it depends on,
I think she's doing the neurotropin product by Royal Lee, and that's the one that's porcine something or other.
Yeah, it depends. Depends. What else we got? Any other questions? Jane.
Comment.
What caught my attention was when you talking about the ER and how years ago people were not going to the ER unless it was an emergency.
Right.
So in just thinking in terms of what was it that brought the change, and it would be interesting to see the correlation between the insurance availability and the ER, because many impoverished people that are and with the government subsidies, etc., and the mandates to the hospitals to cover whoever comes in for whatever, a lot of people are just going to an ER out of convenience or the lack of funds. And with the insurance figuring that it would quote unquote not be out of their pocket as a convenience. So
Yeah.
going for, because years ago it was,
There are people that use ambulance rides to get to the other side of town.
gosh,
So if you talk to any EMTs or paramedics, they'll tell you we've got frequent flyers that just call because they want to go to the hospital. Not necessarily because they're sick, but they just want to ride, and that's your taxpayer money. And that's what happens when you put other companies in charge of that have a financial interest in selling premiums and deductibles and copays and prescriptions and this and that, and you intermingle them with the government.
yeah.
That's what happens. It's no longer so emergency rooms have become so astronomically inflated because of the money printers and everything's, a $600 Tylenol that I've seen on personal health records coming through here. People bring their stuff to me and I go, you paid $600 for a Tylenol? You could have bought, stock in the company for that, So what did some young, enterprising, entrepreneurial medical doctors do? They went out and started all these shops that you see now that are these urgent care, walk-in clinic, express cares, and put people in charge to spread this stuff. Like there's one down here that's 50 locations. Within walking, you could throw a stone and hit it from here. And there's probably 5 of them in a 2 mile, I'm not even kidding, probably half-mile radius. There's probably 5 or 6 of them. So how did that happen? Well, they just hired doctors and they hired nurses and they hired front desk staff to come in and undercut the emergency rooms. And that's why you've seen so many urgent care centers and things like that pop up all over the place. Because the emergency rooms are pricing themselves out, and all these people, now, all the stats I showed you were just emergency rooms. Imagine all the urgent care, express care, walk-in clinics where you just walk in, hey, my kid's got a sniffle. Here's an antibiotic. Doc in a box. I call them doc in a box. But think about that. That would be hundreds of millions of, I drive past 5 of them on the way here, and they're packed before I even get to my office. In the morning, every morning. It's nuts. People are wondering why nobody thinks right, and people are wondering why everybody's sick. Look at American healthcare. We're just drugging the entire population multiple times. How did it get so out of control? Insurance. Money printers. Because when you're standing next to the money printer in the government, you can hand it out to your buddies at the hospitals and your buddies at the managed HMOs and your buddies at the insurance companies. It's not the pharmaceutical companies that run everything, it's the insurance companies that run everything.
Insurance. And an added detriment are those who serve as EMTs.
The who what now?
Detriment
Detriment.
is the stress that is imposed on the EMTs
Oh,
and
yeah.
the police. They
Oh, yeah.
and the families that they're a part of. It's
Right.
just it's terrible.
It's like
Compounded.
it's completely, if you talk to any of these guys, like it's a paycheck, but at the same time, like just in the last 6 years, just since the COVID hoax took over, like they're trying to hold it together. It's crazy.
They're hard to find.
Yeah. So it's crazy.
So the increase of it.
You got anything you want to say, Jim, about any of this? No? Anybody else? I just figured you might want to say a little something about your, any experience with any of this? If you want to say something. You don't have to implicate yourself, but, Did it turn on?
about
Is
the
there a
Nar-
light on there?
Yeah.
Okay.
About the Narcan,
Yeah.
a lot of police officers carry it around also.
Mhm.
And I was the thing about 4 times in one day was news to me. I know we had one here in town that was twice in the same day. They brought this girl back, and a few hours later had to give her another dose.
Yep.
And they've had them, one, and then the next time they weren't able to bring them back. They were
Right.
too far gone.
I bet.
But it's here.
It happens every day, unfortunately. But yeah, where's it all coming from? Where's everybody getting a hold of this stuff? Yeah, their doctor, but where's their doctor getting it? It's coming from China. Where's all the fentanyl coming from?
That ninja cocktail that you referenced, do they give all 4 of those at the same time?
Depends. Depends on the city, depends on the trucks, depends on the people, depends on how busy they are.
Okay.
I wouldn't say here, no. In Cleveland, Bradley County, they're not doing that. No, but bigger cities. Chemotherapy can't be good, but they do it, right? Okay, anything else? Closing out. So remember, November, what is it? 6th? Yes, November 6th, Family Feud, the Holiday Health Edition. It's going to be fun. We're going to have a good time. So Dr. Brett Spradlin signing off. Thank you very much. Have a good night.